I often have the conversation with students and colleagues and people that I work with at the counseling office, not clients, but other counselors at the office. I guess you could call them colleagues too. But they are often drawn to the counseling field because it is different than the medical. Meaning psychologists, psychiatrists, medical doctors, nurses, nurse practitioners all use what's called the medical model. Well, maybe not all of them, but they're trained in the medical model. And the medical model is, I see a problem, I treat it. I see a problem, I treat it. There's not as much preventative care. Within the counseling world, we look at people, we want to know what's going wrong, yes, because we're going to have to work with that. But we want to know what's already going well in their lives. What are the strengths? What are the positives? What are the things that we can build on? So if we can build on those things that are already good in their lives, we can use that momentum and work against those negative things or build them up so that we don't have bigger problems down the road. When I was doing wraparound work early on in my career, you had to have a master's degree because we did some therapy and some testing, those kind of things. In most places, they don't need a master's degree, but my county was different. But when I was doing that, we would look at lists of positive things about these kids who are having all these kinds of trouble. And we would sit down with the family and we would say, what is good about your child? What can we use to help build up these areas of weakness so that they become strengths too? It was often said of Michael Jordan and Larry Bird, if they had a weakness and they figured it out what it was, they would go into the gym and for hours and hours and hours and hours and hours until that weakness became a strength. If I recall correctly, Jordan early on, they said he couldn't shoot as well, though he was a good shooter. They said he couldn't play defense as well. He would just work at it until he was all defense, or until he was the best shooter in the NBA. There were guys that would talk junk to him in the games, and he would put up 40, 50 points on him. Why? Because you're not going to tell me it's a weakness. I'm going to make it into a strength. And so this is really a wellness model in kind of an unhealthy way. But if we can look at what people already have going well and build on it and go from there and talk about those things and focus and help it bleed out to other areas, then we will have greater strength in people's lives. Because if we just find cancer and cut it out, as opposed to teach people how to avoid cancer in the first place, or if we just find heart disease or we react to a heart attack, as opposed to teaching people to eat better up front, what good are we doing? Well, we're saving people's lives, but could we have helped them avoid that problem and have had a greater quality of life in the first place? This is the wellness model, and it's the way counselors approach people.